Okay, so good afternoon and welcome to today's talk on recognizing early signs of autism. So thank you for joining us for this year's Baby and Family Fair virtual series that's hosted by Tallahassee Memorial HealthCare. I'm excited to have the opportunity to unpack this very important topic with you all. This is something I feel is important for both parents and providers to be aware of. Before we get started, I want to introduce myself. So my name is Dr. Moltisanti. I'm a neuropsychologist at TMH. So I do lifespan work, meaning that I see both children and adults. And being a neuropsychologist means I specialize in evaluating the brain abilities when people have had some sort of injury or if there's some sort of abnormality in their brain's development. So my goal today is to share with you all a couple things about autism. So covering what autism is, the importance of early intervention with autism, why that's so crucial, and some early signs that you can look out for with your own children. And if something does come up, how you can find evaluation and good treatment options. Okay, so I look forward to answering all of your questions later on in the webinar. If you think of any questions as we go, please use the Q&A feature in Zoom to submit them. And I'll be monitoring that as they come through and answering them at the end of today's talk. Okay, so let's get started. Okay, looks like you guys can see that okay. All righty. All right, so we're going to start out by talking about what is autism. So autism is a neurodevelopmental disorder, and that means that there is an abnormality in the development of the brain, and that abnormality is present from the time of birth. And the symptoms of autism become apparent as a child moves through their stages of development. So there are two main symptom areas in autism, and I'm going to cover this really broadly up front, and then I'm going to get into a lot more detail later on. One of those core features is a deficit in basic social skills. And so when I say basic social skills, I'm referring to social behaviors that are so basic that they're seen even in young infants. So some very basic social behaviors would include looking at people's faces, having an interest in interacting with people, smiling at people. So these skills are so basic that they come naturally to most people without having to be taught. They are inherent, but they don't come naturally in autism. The other major symptom domain is what's called restricted and repetitive behaviors. This really covers a range of atypical behaviors. I'll just very briefly summarize currently. So there can be repetitive movements and repetitive play. So that can involve like overly repetitive patterns to play, like wanting to flip light switches on and off, on and off. Or restricted range of behaviors. So that means patterns of behaviors that have a narrow range. So that can be things like being extremely inflexible with the schedule, like even a minor change in the schedule is bothersome. I'll go into this in a lot more detail, but those are just a couple examples. Now, with autism, there are some really common co-occurring problems. So intellectual ability ranges widely in autism, and there is a high rate of intellectual disability. About 30% of individuals diagnosed with autism also have co-occurring intellectual disability, but some individuals with autism have average or even above average intelligence, so there really is a wide range. Also, sometimes there is co-occurring language disorder, and that means that a language disorder is where a child does not properly develop full language skills and they have difficulty speaking and expressing themselves. And some individuals with autism are entirely nonverbal. I mean, they have almost no language ability, and others have perfectly normal language. Some have advanced vocabulary. So again, there can be a wide range there. Something I'm commonly asked about is cause. So what causes autism? And the science really indicates that autism is highly heritable. That's the main factor. So the estimates of heritability range between 60 to 90%. There are also environmental factors, but their impact is much smaller, so closer to 1%. One known environmental risk factor is advanced parental age. But overall, this is a complex interaction of genes with environment that leads to or gives rise to autism, but with genetics really playing a big piece of that interaction. I do like to point out that there is no evidence that vaccines are associated with autism. It's just sort of a myth. There's never been any scientific evidence to support that. And I think some of the most compelling evidence for that is that because autism is a neurodevelopmental disorder, the symptoms of autism are seen, early on. The disorder starts at birth, and so you can start to see those signs and symptoms before the age where children would have even received vaccines. Okay. So I'm going to talk about why early intervention and diagnosis is so crucial. So the earliest signs of autism appear at age 1. They can also appear earlier, but it's more subtle to notice. And so these symptoms gradually unfold from ages 1 to 2 over that second year of life. And a stable diagnosis of autism can be made as early as 18 months, between 18 and 24 months is kind of a common window. But unfortunately, what happens is that most children don't get diagnosed until they are school aged. And this is a big issue and an issue that the field is trying to address, because these children miss a very important window for early intervention that occurs between infancy and being school aged. So with early intervention, the earlier the better. It is essential to try and get intervention on board as early as we can. And part of that reason is because, as we talked about, or a large part of that reason is that one of the core features of autism is these deficits in basic social behaviors and social engagement. And those early social behaviors are very important in helping your child to develop and develop language skills, develop cognitive ability. So much of our learning, it occurs by interacting with the environment. So infants and toddlers are missing out on a lot of learning opportunities if they have autism, because that social component facilitates all facets of development. So getting a child involved with early intervention as early as we can has some proven benefits. It improves language skills. So it can have a child who may have been nonverbal can progress to being more verbal. And it also can actually increase IQ points. So we're facilitating cognitive development. And there is some theories that the language delays and cognitive delays for some children with autism are actually secondary. They're caused by the social deficit. So they're in essence preventable if we get the right treatments on board. That's not true for everyone with autism, but for some. And ultimately, this helps to improve social development. So down the road, those social deficits in autism cause difficulties with making friends, keeping relationships, and so we can help to head off those problems with early intervention. So because of all of this, developmental monitoring is very important. And basically that involves monitoring the major milestones where we would expect children to be at certain ages and what their peers would typically be able to do, and keeping track of that. So walking and talking are very common examples of this. So your child should start standing without help around 10 to 12 months of age. Your child should have 1 or 2 words that they're using around 12 months. And there is flexibility in those milestones, and there can be some normal variability, but if we're seeing consistently delayed milestones, that can raise some flags that intervention is needed. So if you're monitoring, if you're checking, milestone checklists which are available, you're going to know right away if there's delays or if there's reasons to be concerned. So because early intervention for autism is so important, I'm going to teach you to recognize some of the early signs of autism. Because if you know what you're looking for, you can spot it pretty early. But if you don't know, and especially if you don't have a lot of experience around toddlers or infants, and you don't really know how social they should be, it can be easy to miss. Okay, so I'm going to talk more about these core features of autism. So we talked about deficits in social interaction and communication, and then the restricted and repetitive behavior. So I'm going to go through these kind of core symptoms and how to recognize early signs of each of them. Okay. So we're going to start with deficits in social interaction and communication. So there are a few specific symptoms that fall under this, and the first is a deficit in social reciprocity. So what is reciprocity? So that has to do with the back and forth quality of social interactions. You probably don't think about this a lot, but it's a built-in skill that a lot of us have to use that back and forth exchange in an interaction. So to break it down kind of simply, like if I was trying to get your attention, I might call your name, and then you would look at me, and I might show you something like, hey, look at this. And then you would follow where I was pointing. Your gaze would be oriented to what I was showing you. Then you might say something about what I showed you, and I might say something back. And that might seem really basic, but that back and forth where we're paying attention and responding to each other, that's what reciprocity is. And reciprocity is one of the areas of core impairment in autism. So a baby with autism might not respond to that prompt where you're trying to get their attention. They may not start a social interaction. They may not say or do things that keep that interaction going. Okay. So let's talk about some signs of deficits in reciprocity. So the first is that it's hard to get your baby to look at you. So it actually should be pretty easy to grab your baby's attention and get them to look in your direction. Babies should be wanting to be near you. They should readily look at your face, look into your eyes. And if it's hard to get your baby to look at you and look in your direction, that could be an early sign of autism. So if your baby's not looking at people's faces, if they're not kind of checking in during an interaction, like if you're playing together and they're not kind of looking and checking in with you periodically, or if they just don't look up to try and get your attention when they think something is cool, like, oh, I really like this toy, is mom looking? Those are some early possible signs of autism. I have a video that really shows a good example of this. Let me see if I can get this to pull up. Okay, it looks like that worked. Okay, so in this video here, keep an eye on the eye contact that the child is making with the therapist.
Lay down, do this. Look at me. Very nice. Lay down, look at me, Shauna, look at me. Look at me. Look.
She's kind of engaged with the interaction, but there really isn't eye contact there. She's really looking off to the side. Oops, we're gonna watch it again. And not when that person kind of initiated that interaction, the child did not kind of direct her eye contact to say, okay, I'm paying attention, what's going on? And really didn't give eye contact throughout. Another sign is that your baby rarely shares enjoyment with you. So babies should be readily sharing their enjoyment with you by smiling, by laughing, and looking at you while they're doing that. So a child with autism might not be smiling a lot during fun activities, or they might smile, but they might not include you in that. So they might smile kind of to themselves and be looking at an object that's cool or fun, but not look up to make sure that you're a part of that enjoyment and smiling at you. So that can be an early sign of autism. Similarly, if your baby's not very expressive, so a typical child should show a lot of different expressions, so smiling, frowning, surprise, excitement, even like disgust, like, oh, that was bad, or grumpiness. And children with autism may have very little expressiveness, and sometimes they can be very flat and just not seem like they have a lot of emotions, or sometimes it might be so hard to get them to smile that you're not really even sure if they're happy or if they're enjoying an activity. I have another example for this one here, another video. So in this video, we're going to see twins. We're going to see a twin who doesn't have autism. That's Ben. We'll see Ben first, and then we'll see his twin Nathan, who does have autism. So I want you to pay attention to their expressions and how engaged they are with the social interaction with mom. Again, this is the child that doesn't have autism. Some really cute smiles. Oh, looking at mom.
That's
the
right.
Toy fell. Some happy vocalizations too. Okay, now this is his brother who has autism.
Push. Good boy. Ready, set, go. Ethan, push. No, stay up here. Stay up here. Go. Stop. No. Nathan. Go. Look, here it is. Scoop the train. Stay up here, please.
And so you can see his brother was really not smiling, not seeming to enjoy that interaction as much. So really flat affect, and also really not a lot of reciprocity in that interaction. So the brother without autism was really into that back and forth rolling and looked at mom when something changed. and was smiling and vocalizing. And the child with autism was kind of just interested in picking up the train and kind of turning off away on his own. And there wasn't any expressiveness there, and there wasn't reciprocity either. It was sort of hard to get him to play with mom. Okay. If your child doesn't respond when you call their name, that can be a red flag for autism. So babies should be really attuned to your voice. So when you call their name or try to get their attention by making a noise or moving into their field of view, they should respond by looking towards you. So you can also work with things like saying, come here, or reaching out to them to get their attention, or waving hi. Babies should be fairly attuned to those things as they're looking for that engagement. So children with autism often don't respond to their name being called, or they may not respond to you trying to get their attention other ways, like pointing. Like they may not look where you point, or they may just look at your hand. So if your baby rarely responds to their name, if they don't respond when you're trying to pick them up, like holding out your arms, those could be some early signs of autism. Again, I have a couple side-by-side videos of this to look at. So the first one is a good response to name. So take a look.
Kyle.
Notice Kyle responded right away.
Yeah.
And he's really interested. He's like, hey, why'd you call my name? Oh, he's coming. It's a great response to a name. Okay. Now I want to show another video where there wasn't such a good response to name. Okay, let's take a look.
You want to try to see?
And that's mom and a therapist.
No. Evan. Evan. Evan.
See, maybe
Coming
if
around
you
to
can
see
get him
his
to
face
respond
here.
to now, you can use touch with his name, like give him a little tickle or something.
Evan.
He's not even giving eye contact. Really.
Evan.
He's just
He likes the tickles, but he's just not
Not-
going to use too much eye
not
contact, but he
responsive to
does
those
smile when you
bids.
tickle him.
Evan. Evan.
you don't always have to work this hard to get the attention of a child with autism. Mom's working really hard here. It's not always that hard. But as the therapist pointed out, he was smiling when he got tickled. He just wasn't turning his head and giving attention and looking for that interaction. Okay. Another possible sign of autism is if your baby rarely shares their interest with you. So babies should be eager to share their interests, and when they're playing with objects, they will often use objects as a way to get your attention. So if a baby is really more interested in the object than your attention and isn't including you in that, that can also be an early sign of autism. And a baby with autism may also just have little interest in others. So they're really interested in the object and just not that interested in the people around them and including them in that. Okay, so I have another 2 videos to show this, and we'll have another chance to look at good engagement and not so much engagement. So this is Caitlin. She's 14 months and she's looking at a book with mom. And this is an example of good engagement.
1, 2, 3, 5.
Throwing out some numbers.
5. 4 little
Beating mom.
kittens. 1, 2, 3, 4.
Pointing because she's engaged with the activity.
Nice little kittens. Kaylin, look. Look.
More
One
pointing.
is 5 cabbages. 1, 2, 3, 4.
5. And then she comes up with the number. And she's returning the page.
2.
So that was nice and engaged. They were doing the activity together. Now we're going to look at an example of, it says inappropriate play, but less social engagement during the play. And this is Evan from the recent video we just saw. And that's mom.
That one doesn't have anything that pops. Look, it goes.
So she's going to try and get him to play with her.
It's for you, Evan. It's for you. Oh, look. Hello? Oh, you want to talk to Evan? Here you go.
There she tries to start a game. And he just doesn't really pick up on that, doesn't really grab that bid. He's really not trying to include the therapist. He's really kind of focused on some fairly simple play with that object and really not pretend play or in social play. He's kind of just playing on his own, just more interested in the object than in the person that's there. And we're about to see another video. Okay. So the next symptom area is deficits in social communication. So this can include verbal aspects of communication, like using language, tone of voice, inflection when you speak. But there are also nonverbal aspects of communication as well, and especially in children who are too young for language. So that includes things like eye contact, looking at your face, gestures. I've been using a lot of gestures to support my communication, facial expressions, smiling, frowning, directing those expressions to people. Those are all aspects of communication that aren't using words. So babies with autism don't use the same amount of social communication. Okay, so one sign could be limited use of gestures. So babies learn to use a range of gestures and sounds around 9 to 16 months to help to express their wants and their needs. So really common ones that come in around 9 months or so are showing and pointing. So showing, like wanting you to look at this item while that they're playing with, trying to get you to be interested in the item that they're interested in, which is of course my phone, or pointing. So if something's interesting over there, they want your attention, they're going to point to that. We saw Caitlin in this video with mom reading a book, pointing to the book a bunch to point out, oh, that's the thing I'm interested in. We're talking about this. So those are some good early communicative gestures. Other ones that show up are reaching, like reaching to be picked up, like raising their arms, giving. So if we're playing with an item and then giving you items, shaking your head no, waving high and by. Those are some early gestures that should start to come on board. If your baby is rarely using these gestures, especially missing out on things like showing and pointing, that could be an early sign of autism. Another thing that can happen is, another sign of autism is using your hand as a tool, which may sound a little odd, but it's something that happens because children with autism they don't really have a lot of ways to communicate. They're not using gestures. They may not be using language. So then they develop kind of unusual ways to get their needs met. And this classic example of this is using your hand as a tool. So that involves like where they take your parent's hand and try to put it on things to show what they need. So like if I need this container open, I might push your hand into the container. And this is especially concerning for autism if they're doing this and they're not making eye contact while they're doing this. They're pushing your hand into a container or pushing your hand onto something that you want and not looking at your face. And what I see with kids with autism is that they're often looking at my hand, because the hand is the thing that gets them what they want. So instead of looking at me to get the container open, they're looking at my hand and pushing my hand into the container. Another sign is language delays. So if your baby isn't saying single words by around 15 months, if they're not starting to use 2-word phrases by 24 months, these can be some early signs that could indicate autism. Language delays aren't specific to autism. A lot of different things can cause language delays. There's global delays, there's language disorders, there's motor disorders, but language delays are very, very common in autism and often one of the earliest signs that parents notice. So monitoring milestones can help you to pick up on this early on. And sometimes language delays resolve totally normally. I was a late talker, and sometimes they don't. So something to be on top of. Little interest in communicating. But also, for example, if a child really doesn't ask for help or request help when they are trying to get something done. So another example of that is like trying to get a container open. If a child is just trying to pull the container open and mom's right there and we're not going, Mom, like it's not working. I want what's inside of this. That's kind of like a reduced drive for communication that can be an early sign of autism. And a typically developing child really should and will know how to ask parents for help, and that comes kind of naturally. There can also be not speaking when there's opportunities to speak or communicate. Like a classic one is if you ask your child a question like, do you want to go to the park? Yes or no? And you just don't get a response. Once a child starts to have language, it can be things like not being very interested in starting a conversation, not coming up to you and sharing information about stuff, like talking about a toy that they like. So if your child isn't requesting, isn't responding to you with communication, or isn't interested in starting a conversation, those are all early signs that there could be autism. Okay. So now we're going to talk about signs under restricted and repetitive behavior. And this covers several different types of symptoms. So the first is stereotyped or repetitive patterns of speech, movement, and play. And by stereotypy, that means basically a repetitive action without a clear purpose. So children with autism often have overly repetitive ways of speaking and acting that don't really have a clear function. And this can look like a lot of different things. So some signs to look for is if there's any unusual movements of hands or fingers or body. So maybe like unusual stiffening or flaring of fingers, or twisting, like wanting to always be twisting our fingers. There can be unusual ways of posturing our body, like holding a hand up like this, or posturing your whole body in sort of an unusual looking posture. Other repetitive movements that are kind of common that people have often heard of are rocking, like really rocking a lot, spinning in circles really frequently. Flapping hands is something that is very commonly known of. These behaviors do overlap with a lot of other things, like a child with ADHD is going to be very active and fidgety. It can be hard to pick out what is a stereotypy and just a kid being fidgety and a kid. But what I would say is if these behaviors are obviously peculiar or they're really repetitive, that's where it starts to be unusual and concerning for autism. And I have a super good example in a video. Sometimes it's hard to kind of explain what this looks like. It's easier to just see it. I don't know what's happening with this one. Go away. Okay. All right, so let's look at Ash. I'll make that full screen. So Ash is enjoying this music, and sort of as a response, he is doing kind of a posturing and flapping with one arm and this repetitive kind of twisting of his other arm. That's just not, that the repetitiveness of that and the movements themselves, they're just not typical. It would not be usual for a typically developing child to do that so repetitively. So that's a particularly good example. It's not always that overt, so it can be more subtle. Okay. And there can also be repetitive or unusual movements with objects, like spinning or wobbling objects. And there can also be lining up toys. That's something that people have often heard of, is like kind of repetitively lining up toys. As you can see in this picture here, this child is interested in lining things up. Every child lines things up to some degree, like a little bit. You might see that throughout play, but really what this looks like is that the child is playing by lining things up, and that's it. We just want to line up the blocks, line up some more blocks, and line up some more blocks, and there's nothing more to the play than that. There can also be other types of repetitive play, like wanting to just open and close a door, open and close a door, open and close a door, turning light switches on and off. And again, these things, typically developing children will have an interest in these things at some point, but they will move on from this readily. It's not a big focus. There can also be repeating a simple action over and over, like putting all the toys in the bin, dumping it out, putting all the toys in the bin, dumping it out. And that is the play, and just doing that over and over again. Another stereotypy or repetitive behavior is repeating exactly what others say, which is referred to as echolalia. This can be immediate or delayed. It's a little easier to notice when it is immediate. And it can be pretty pronounced when it happens. And I have another video that is a super good example of this. Okay. So Lucas has several examples of echolalia throughout this video, so listen closely.
Hi, Lucas.
There was one.
Say no, say hi, Georgia.
Hi, Lola.
Give me a hug. Come here. Come here. I gotta tell you something. Hi. Give me a big hug. Oh. How are you?
How are you?
I'm
Said Echolalia.
I'm fine.
Good. Are you playing?
I'm fine.
Are you playing? So he's repeating what she says in a sort of the key is it's a non-functional way. He's just repeating. He's not using that as in a communicative function. So within restricted and repetitive behaviors, another symptom is inflexibility, rigidity, and resistance to change. So children with autism can be excessively rigid about routines, or they may struggle a lot even with minor change. So some signs to look for with this. If your child develops rituals and gets really upset with change with those rituals, and typically developing children, babies like routine, like they like things like a bedtime routine, but a typically developing child can sort of flow with changes in that routine. Like if you had to add a step or it had to get delayed by 5 minutes, that should be tolerable. But a child with autism may really struggle even if there's a minor change in that routine. A child with autism may also develop their own routine that is maybe really inflexible or sort of unusual, like insisting on turning in a circle 3 times before we enter a room. Or maybe they create a ritual with a daily life activity. So every time we go to leave the house, every single door has to be shut first, or it's a problem. Like it might cause a meltdown or getting really upset if we can't carry out that ritual. Another thing that falls under this is what's called insistence on sameness. And this involves wanting things to be the exact same way every time. And if that can't happen, it's very upsetting. Like, for example, if you rearrange the furniture in the living room, and if that causes your child to be very upset because there's changes in that scenery, that could be an early sign of autism. Some children with autism would, for example, insist on eating the same exact meal every day, no deviations. That can mean, I can't tolerate a different brand of cream cheese or a different flavor. The next symptom under restricted and repetitive behaviors is highly unusual or intense interests. So children with autism can develop very intense interests or become interested in things that are unusual for their age. This can also include just having a really narrow range of interests, like only liking monster trucks and just having no interest in anything else. It's all we do day and night, monster trucks, no other toy is interesting. And that's all we want to talk about. Okay, so some signs to look for. Excessive interest in particular objects or activities. So babies should be able to readily shift their attention between an object and a person, and that creates an opportunity for a social interaction. So we're not just playing, we're playing with a person, and we're kind of learning when we play. Babies with autism may show an excessive interest in a particular object or activity and just get overly focused on that without folding social interactions into that. So it might be very difficult for babies with autism to shift their attention away from an object that they're super interested in. So for example, I was working with a child with autism who we started out playing with some different toys. He got interested in the Jack in the Box toy, and then that is all he wanted to play with the entire time I worked with him. And I have a lot of cool toys, and I couldn't get him off Jack in the Box for over an hour, and it just was going to cause a meltdown. It wasn't feasible to shift. So that is an excessive interest in a particular object. Children with autism can also become very focused on unusual objects. So you may notice abnormal or unusual kind of focuses or wanting to carry around or use something that maybe isn't a toy, like a spoon, a toothbrush, a piece of cloth, like wanting to play with a piece of cloth a lot, a toilet brush. And part of the quality of this, babies are going to get interested in like lots of different items if it's in front of them, but this has to do with being more interested in this piece of cloth than anything else, even in toys, or wanting to carry that piece of cloth around all day and night, or just being more interested in those objects than people and other more typically toys that are more typical for their age. I once had a kid that I worked with who was really interested in carrying around a rusty deer hunting camera day and night all the time. That was his thing. Oops, I have one more there. Let me go back. There can also be unusually intense interests or preoccupations. So sometimes a child with autism will just become interested in a topic to an unusual extent. Like a really common one, and it was common for a while to see children who were with autism who were really interested in Thomas the Train Engine. That's all we wanted to do is watch Thomas the Train, talk about Thomas the Train, read, learn everything that has to do with that. And it's just an overly intense focus. You can also see interests in topics or objects that are kind of peculiar. Like I've heard a few times about individuals with autism becoming really interested in vacuum cleaners, and maybe wanting to take them apart and put them back together, wanting to study them. We know the different models and makes. We've collected a bunch of vacuum cleaners. You know, we can tell you a million things about vacuum cleaners that you never wanted to know. That can be kind of a sign of an unusual focused interest. I once had a child that I was working with who was really interested in the days of the week. That was his interest, and days of the week were worked into every conversation that we had. So I was hearing about days of the week, no matter what we were talking about, which suggests a focused interest. Okay. The last symptom in this category is overreactivity and underreactivity to sensory input. So sensory input can be overwhelming and upsetting for kids with autism. It can be like too much. They can also have the opposite. They can be undersensitive to certain sensory inputs, or they can have sensory interest. So it kind of covers a range of things, and I'll talk about those. So unusual sensory interest. So babies with autism can kind of have an unusually intense focus or interest in how things look, smell, feel, etc. And there's a couple kind of classic ways this manifests. So like closely inspecting an object for no clear reason. So like holding things up really close to their eyes, and we want to look at it super close, or like looking at it at unusual angles, like wanting to look at how things look right out of the corner of their eyes. It's called peering. It's kind of a common thing. It can also be like, I want to look at how this object moves, so I'm kind of just waving it in front of my face. Sometimes kids just do that with their hands. They're holding their hands in front of their face and looking at that a lot. Oops. Can also be, it doesn't have to be sight. It can be preoccupation with texture. Like I always want to touch this one mesh thing that you have in the office. I'm just touching it and touching it. Or it could be, you know, I like the way this feels and I'm rubbing it on my face, rubbing it on my face a lot. Okay. There can also be the opposite, sensory aversions. So babies with autism and toddlers can be very sensitive to specific sounds, sights, textures, and it involves kind of being overly bothered by these things, like being bothered by the sound of aluminum foil. Like that sound in particular is very bothersome. Or being really easily bothered by different food tastes or textures, so much that the child may gag when they're eating certain foods that, you know, aren't that offensive. And you may see too with these sensory aversions sort of an unusual reaction that can kind of give a sense that it's more than a usual aversion. So you might see like arm flapping or like blinking really intensely in a reaction to these sensory stimulations. And I will say sensory aversions to some degree you'll see in most kids. Like most kids don't like a tag in their shirt. And a lot of kids are bothered by loud noises. So we are looking for an unusual extent and sometimes like peculiar sounds, like that aluminum foil thing, like that in particular bothers me, or really intense reactions. I had a child not too long ago who was really upset by the sound of like 3 little blocks falling over. It was not very loud, and just any little sound like that really upset the child. And that was kind of more clearly different than a child just being bothered by very loud noises in general, which is sort of typical. Okay. Then there can also be insensitivity to pain. So that kind of falls under the hyporeactivity. So it could be stuff like poking your own eyes because we don't really feel the pain. So we're actually causing some damage, do something that's dangerous. I had a child who had a broken clavicle and was so hyporeactive to pain, they had no idea. They were just flailing all around, didn't bother him one bit. Okay, so those are the signs of autism, and I want to cover what to do if you are concerned about autism. And I want to kind of emphasize, keep in mind that we are looking for a collection of symptoms here. So I don't want you to get worried just as you see one sign that your child might have been bothered by a loud noise on one occasion. Really, we're looking for seeing several of these things, 4 to 8 signs of the things that we talked about. And there has to be both social deficits and those repetitive behaviors. Repetitive behaviors can be a little bit hard to tell if it really is on the level that it's unusual. So also, you know, if you're concerned, look for those social deficits as well. If you are concerned, the first place to start would be to discuss concerns with your pediatrician. The pediatrician can do a screening for autism. Sometimes they're comfortable diagnosing, often they'll refer for a more in-depth evaluation. And your pediatrician should be doing periodic developmental screenings as it is, but they don't catch everything. So, you know, it's helpful to be an advocate and to bring up things that you're noticing. You could run into pediatricians or any provider who wants to kind of do the wait and see approach. That is something that's common because sometimes these delays do resolve themselves. So sometimes, you know, the advice is let's wait and let's see if they develop language. And
Touch your toes.
there's some merit to that. Am I hearing
Show me
somebody?
your nose again. Where's your nose? Where are your eyes? Eyes. Those are hard to touch, huh?
My video is playing on its own. Okay, sorry. I broke it. There we go. Okay. Let's see. So pediatrician might have that wait and see approach, which sometimes has merit, but I would advise you, if you're concerned, you should feel like you can advocate for yourself and push a little bit to make sure that something's not getting missed. So in terms of who can diagnose autism, sometimes physicians, although they often, unless they're really confident, they may want to refer out. Clinical psychologists are really the most common person who diagnoses autism. I'm a clinical psychologist. And also sometimes school psychologists will diagnose. And sometimes they work for the school system. Sometimes they're available in the school system. And a formal diagnosis is often needed to get insurance to cover treatments. Okay. So last thing I want to talk about is intervention. So there is no cure for autism. If a child has autism, that is a lifelong thing, but there can be substantial symptom reduction with intervention. So treatments for autism will target the core areas of deficit, including social skills, language skills, and also cognitive development. So there are a couple options. I don't think I got this in the right order, so let me just skip through all that. There we go. Okay. There are a couple things you can do. So for toddlers who have not just signs of autism, but really any early delay in motor, in language development, and in social development, you can go through the state program, Early Steps. So that is a statewide program that offers therapy services to any child who's at risk for developmental delays. So they will do speech therapy, physical therapy, and occupational therapy. Speech therapy is particularly relevant in autism. So a speech therapist can help to work on developing language skills, developing words, and learning how to use words and communicate. But they're also an expert in any form of communication. As we talked about, communication is more than just language. So speech language pathologists are a really good resource if we're concerned about autism. In conjunction with those services, I think it is helpful to add on a behavioral therapy component. The specific nature of the behavioral therapy, this is something that is debated to some degree what's best. The most widely available therapy is what's called applied behavioral analysis, or ABA therapy. And this is also the most often covered by insurance. So this is probably the most feasible. There is some debate. Some parents aren't a big fan of ABA, and I can answer questions about that if people have them. What I usually do is coach parents and families to look for behavioral interventions, ABA or an equivalent, that has certain components that are really important. A major one being that they are family focused. So parents should be involved in learning the intervention so that they can use it themselves. If you think about it, a child's development and learning is happening all the time, not just when we're with a therapist. So we want parents to learn how to encourage language, elicit social attention, get their child engaged in activities. And parents are going to be a big piece of helping to give that child learning opportunities that they might be missing out on. Another main.
Okay. Can anyone hear me? Can someone unmute and say if you can hear me?
We can hear you, Dr. Moltisanti.
Okay, cool. That was weird. All right. Well, I was just wrapping up about interventions, just largely talking about how it's best to disseminate them in sort of a natural context and using natural reinforcers. So like using a toy that the child likes as a reward instead of something kind of arbitrary, like a piece of candy. And I can talk more about that if that's of interest, but it's sort of a debate in the field, the best way to implement the intervention. So it's something that I do coach parents on. One of the last things that I usually recommend if we're concerned is to look into, starting at ages 3 to 5, is early childhood special education, which would be provided, through the state. This is a free resource for children with disabilities to get into the special education preschool program. And that can be super helpful because it can really help to support early development. There are also some supportive organizations that are really important. So there is the FSU Center for Autism and Related Disabilities. That is an amazing local resource. And they basically just help patients to navigate the available resources and to figure out what to do next. So what treatments are a good option, what schools, what services. And that is a statewide program. So it's not just in Tallahassee, but there's CARD centers. CARD is the acronym all over the state. So there's lots of options for early intervention and lots of resources available. One other resource that I wanted to plug, and I wish I could show you this, but it's called the Baby Navigator. There's this website that is developed by an FSU autism researcher that basically lets you kind of monitor social milestones. So they offer social milestone tracking and they show videos, so you can kind of learn and be aware of things. So if you follow with the Baby Navigator regularly, like I'm not sure how often they email people, but every few months and complete like social development and language screenings. If there is anything that comes up, they'll flag it and they do all sorts of interventions and things like that. They're a really amazing resource, sort of a little known resource. That was everything that I wanted to cover. So I'm happy to transition into questions now if there are any questions.
Sure, Dr. Moltisanti, we actually have a lot of questions, so I'm going to go through them. I'll just give you one at a time and you can answer. The first one is, when would no eye contact be most concerning? Is it concerning if they have minimal eye contact or issues with attention at less than 12 months? For example, if they do that at like 3 to 6 months old?
I would say, that skill is still coming on board. Like a 2-month-old will like try to turn their heads towards, sounds, and they'll start kind of orienting towards you, but that's too early to really expect consistent eye contact. But it should start to develop, past 6 months that it's becoming more consistent. You should start to see early signs of it, but I wouldn't get too concerned until kind of like we're getting later on within the first year, closer to 8-9 months, looking for that kind of consistent eye contact. And you're not having a conversation back and forth with the child at 9 months. So you're really just looking for that simple checking in with eye contact, looking at parents.
Okay, great. Next question. Could not minding attention to play with a parent be mistaken for attention disorder versus autism?
That is a super good question. And even though autism and ADHD are really distinct in theory on paper, there does seem to be a lot of overlap. I get a lot of autism referrals that are actually ADHD. And yes, so it can be difficult to get the attention of a child with ADHD, especially if they're hyper-focused on something. So that, I wouldn't rely solely on that feature where it's difficult to gain a child's attention. I would also look for other signs of social deficit, like we're not interested in being social, or we don't smile, or we don't look at people's faces. But, sometimes I get kind of a false red flag on a child who really has ADHD because they are failing that test where I'm trying to call their name because they are just too zoned into something else. So that is, and if you are concerned, if you're noticing things it's okay to get an evaluation and hear, yes, this is ADHD. But yes, there can actually be a lot of symptom overlap there.
Okay, great, thank you. Someone complimented your Keurig in the background and also asked if you could explain, I might say this wrong, the diathesis stress model and how it can be applied to autism spectrum disorder.
Okay, interesting question. Well, first of all, I'm a coffee addict, so thank you. I very much prize my Keurig. The diathesis stress model, that's an interesting point because I think about that a lot with disorders like depression, like behavioral disorders, things that unfold, over the lifespan. Whereas with autism, I think of that more as prenatal and genetic. But, in terms of the genetic unfolding, there may be that there has to be a certain genetic loading, and then other environmental factors might exacerbate that. So a really good example is like this parental age factor, that, not every parent of advanced age is going to have a child with autism, but that may be one of the quote stressors, advanced parental age, that can exacerbate some of the underlying genetic risk. And it's specifically advanced age of dads. So that's not sort of widely known, but yes, I suppose that's an example of that.
Okay. The next question is how comorbid is autism spectrum disorder with OCD or OCPD?
Ooh, interesting question. I do believe there is some comorbidity with OCD. I don't think that there's as much of an etiologic connection to OCPD, but the difficulty there is that sometimes I think there's some measurement issue where repetitive behaviors and focused interests look a lot like, obsessions and perfectionism and compulsions in OCD. So I believe there is an elevated base rate, but I don't think it's a very high comorbidity like language disorder is or like intellectual disability is.
Okay. What is the difference between just a speech delay and actual autism?
So a speech delay is not a specific disorder in of itself. There can be speech delays for all sorts of reasons. So speech delay can occur in the context of like global developmental delays, like if somebody has like cognitive delays, you would probably see speech delays. If somebody has like motor problems, like problems with, motor movement of mouth muscles and things like that, or even a tongue tie. There are a lot of things that can cause a language delay. So it can be a sign for autism because of the reasons we discussed about, social engagement and learning, but it can also be a sign of a lot of other things, and it can also resolve spontaneously. So it's something to definitely keep an eye on, and there is no harm in doing early language intervention speech therapy for a delay that resolves on its own. There's more harm in missing a delay that doesn't resolve on its own.
Great. The next question is, at what point do you seek intervention?
That is a good question. I think as early as you are confident that there's something abnormal about your child's development is a time to go at least start with early steps. There are children under 12 months that at least start out with early steps because you're going to get the speech therapy, occupational therapy, if there's anything physical therapy, those supports can get on board so early, even if we're not sure if there really truly is a delay or a neurodevelopmental disorder, and that reaching out and seeking that intervention, you're going to get a structured evaluation by experts who know these milestones well. So you might go reach out to early steps and hear, there's not really a delay to the degree that I'm concerned. Like we don't need to do anything. So there is no harm in reaching out there. In terms of, specifically getting a diagnosis of autism, it's probably not common to find a provider who is willing to diagnose. I think 18 months really is the cutoff. But I think it's perfectly reasonable to start asking the question at that point and start looking for an evaluation, especially if you see a lot of signs and you're really concerned. And absolutely by 18 months, And again, I want to point to the Baby Navigator as a resource here. It can be difficult to find providers willing to see children under 3 years of age. This is sort of a bottleneck in the field. It's just challenging. There's just not enough providers. But the Baby Navigator provides virtual online diagnostic. Well, it's not a diagnostic evaluation, but it is an evaluation for red flags of autism, and then they can enroll children in early intervention. So yeah, as soon as you become concerned, but I would say before 18 months, you're probably not going to get a diagnosis.
Okay. Someone asked, how do you vet a good therapist or special education? I think it's SE educator. And noticing any signs of mistreatment to your autistic child if they aren't communicative vocally or physically. I know there are plenty of wonderful people in the field, but I'm afraid of finding the one delightful one and trusting my child with them.
That's a really good question. There's benefit to going through a resource that knows the local community well, which is why I refer all of my patients when there's concerns of autism to FSU CARD, the Center for Autism and Related Disabilities, because they know the local providers. And I'm newer to the area and don't know the providers individually. Otherwise, I would say the person who's doing the diagnosis can probably help you to connect to people who are good. But like asking a lot of questions, asking who we trust in the area. There's a lot of like Facebook groups where kind of moms get together and their parents and exchange kind of opinions on different facilities. So it's not a straightforward answer, but it's about vetting the different options locally. So, doing your research beforehand and then meeting with the providers, asking questions, asking about their approach, getting a feel for the clinic itself, and then being present for some of the therapies, kind of doing your own detective work to some degree.
Okay. The next question is, when is inflexibility considered normal? My toddler likes things to be a certain way or in a certain order most of the time and very much wants to do things on her own. When she's not allowed to do something or there are changes, she wants to reset the situation back to the beginning and start completely over. She will have extreme meltdowns that are difficult for her to recover from.
This is a super good question. And it's sort of hard to kind of give a clear, definitive cutoff. I mean, it can be that's more rigid than, peers, but not necessarily a feature of autism. It may merit some evaluation, but it can also be some toddlers are rigid and they want things done in exactly their way. And sometimes it's not a feature of anything, or sometimes it's actually a sign of anxiety. Or sometimes it's mood regulation stuff. So it's a little bit hard to put a discrete cutoff of what amount of rigidity is too rigid, because sometimes kids who don't have autism can be exceptionally rigid. So I would say if we're concerned about autism, kind of looking out for other symptoms as well. But also if we are so inflexible and so rigid and it's causing meltdowns and stuff all the time, I think that in and of itself can be a reason to seek out some treatment or some, at least some evaluation to see is there anything we can do different to help my child tolerate change a little bit better and manage their emotions more.
Okay. The last question that we have is, my partner is autistic and I have immediate family with autism. I did not realize genetically that it's a 60 to 90% hereditary risk. Is this something we should get screened solely based on that fact? And is the risk higher if the parent has it?
So the risk is higher if your parents have it, but it's not that like 60% to 90% of children whose parent has autism will receive it. It's just that 60 to 90% of the variability in autism is in its etiology is genetic, meaning that most of the causal factors are genetic, but that doesn't mean it's 60% likely you'll get it if your parents have it. It gets kind of complicated in terms of how to interpret heritability numbers. And I don't know what the likelihood of kind of like it being passed on is. I would say if it runs in the family and you have social difficulties or concerns, or you feel like it's a fit for you, that might be worth looking into. If it runs the family and you have a young child, I think it would just make sense to monitor those milestones and keep an eye out and look, be informed about language delays, early social deficits, and if something comes up, then you're that much more armed to be ready to know what to do next.
Great. Well, Dr. Moltisanti, that brings us to the end of the Q&A.
Alrighty. Well, thank you. And sorry that the video broke down. My internet is not working on my computer. I don't know if that factors in, but thanks for being flexible. I appreciate it.
Yeah, no problem. Thanks everyone for joining us, and thanks for your patience. That brings us to the end of our time today. So thank you again, everyone, for joining. If you'd like to learn even more about the Pediatric Neuropsychology services available at TMH, you can visit tmh.org/neuropsych. And we hope you'll join us for the remainder of Baby and Family Fair. We have 2 webinars tomorrow. We have one about developmental milestones at noon, and the rest of the lineup can be found at tmh.org/fair. Have a great day, everyone. Thank you, Dr. Moltisanti.
All right. Thank you.